Let's have a very honest, private conversation right now, just you and me. How many times this week did you sneeze and panic? How many times did you laugh at a joke, only to feel that sudden, humiliating warmth? How much money have you spent this year on pads, lighters, or special underwear? If you are over 60, society and the billion-dollar hygiene industry wants you to believe that leaking urine is just the price of admission for aging. They want you to believe that once you hit a certain age, or after you've had children, or after menopause, andropause, your body just gives up. They want you to buy pads for the rest of your life. I'm here to tell you that's a lie. Leaking urine, whether it's stress incontinence when you cough or urge incontinence when you hear running water, is not a disease of aging. It's a dysfunction of pressure management. Think of your abdomen like a tube of toothpaste. Your bladder is at the bottom near the cap. When you cough, laugh, or lift a grocery bag, you are squeezing that tube. If the muscles at the bottom, your pelvic floor, are weak or uncoordinated, the cap blows off and you leak. It's simple mechanics. The tragedy is that most people try to fix this by doing hundreds of Kegels, often squeezing the wrong muscles, holding their breath, and actually making the problem worse by increasing the pressure. Today, we stop the guessing game. We're going to stop treating the symptom with pads and start treating the root cause with physics. I have designed a 5-step protocol specifically for the 60-plus body. These are not just squeezes. These are functional movements that retrain your brain to close the cap automatically before you even think about it. Put down the heavy weights. Forget high-impact jumping. We're going to rebuild your internal support system from the inside out. Today is the day you start earning your confidence back. Before we begin, if you're ready to stop accepting normal aging and start taking control of your body, please click that subscribe button right now. We're building a community here dedicated to aging with strength, and I don't want you to miss the tools you need to live freely. Thank you. Now, let's get on the mat. Exercise number 1, the zipper breath. We begin not with the pelvic floor itself, but with its best friend, the transversus abdominis. This is your body's natural corset. Without this muscle working, your pelvic floor has no support. Lie flat on your back with your knees bent and feet flat on the floor. Place your hands on your lower belly, just inside your hip bones. Most people, when told to tighten their core, push their belly out, or they suck their stomach in by holding their breath. Both of these actions push pressure down onto the bladder. This is exactly why you leak when you exert yourself. We need to reverse this habit. I want you to imagine you are putting on a pair of tight jeans. You know that feeling when you have to zip them up? You don't suck in your chest. You gently draw your lower belly away from the waistband. Inhale deeply through your nose, letting your belly rise into your hands. Now, as you exhale through your mouth, make a shh sound. Imagine pulling a zipper from your pubic bone up to your belly button. Feel the muscles under your fingers firm up and pull in toward your spine. Exercise number 2, bridge with a squeeze. Now that we have the breath, we need to recruit the neighbors. The adductors, your inner thigh muscles, have a secret connection to your pelvic floor. Stay on your back, knees bent. I want you to grab a yoga block, a rolled up towel, or a firm pillow. Place it between your knees. The nerves that supply your inner thighs share a pathway with the pelvic floor. It is very difficult for many seniors to feel a Kegel. It feels abstract, but everyone knows how to squeeze their knees together. By squeezing an object, we trigger an overflow effect, where the pelvic floor automatically contracts along with the thighs. It's a cheat code for your bladder. Right, we're going to combine this with a bridge to get gravity on our side. Inhale to prepare. Exhale, squeeze the block with your knees, giving it about 50% effort, and simultaneously peel your hips off the floor. As you lift, think about that zipper again. Hold at the top for 3 seconds. Keep squeezing the block. Inhale as you lower down, releasing the squeeze. If you can master this breath, you've solved 50% of the leakage puzzle. If you could feel that deep connection in your lower belly, even just a little bit, please hit the like button on this video. By liking the video, you're telling YouTube that this information is valuable. You're helping us reach other seniors who are suffering in silence and think there is no hope. Let's help them find the solution too. By lifting your hips, we are taking the weight of your organs off the pelvic floor. This allows the muscles to contract fully without fighting the heavy load of your intestines and bladder. It is a safe environment to build strength. A few important things to remember here. Do not squeeze so hard your knees shake. Do not arch your back to the sky. And most importantly, do not hold your breath. If you hold your breath, you increase intra-abdominal pressure, which defeats the purpose. You must exhale on the effort. Let's do 10 repetitions. Squeeze, lift, exhale. Feel that deep connection in the low pelvis. Lower, inhale, relax. This exercise is particularly powerful for stress incontinence, leaking when you cough or sneeze. It strengthens the mechanism that clamps the urethra shut under pressure. Exercise number 3, the clamshell. We work the inner thighs, now we must work the outer hips, the gluteus medius. Roll over onto your side. Rest your head on your arm or a pillow. Bend your knees at a 45-degree angle. Your feet should be in line with your spine. Keep your heels glued together. Why are we working the hips to fix the bladder? Because the pelvic floor is the floor of your house. Your hips are the walls. If the walls are weak or unstable, the floor will sag. Many seniors suffer from leaks simply because their glutes have gone to sleep from years of sitting. When the glutes stop working, the pelvic floor has to do double duty, stabilizing the pelvis and holding in urine. It gets exhausted and gives up. That is when you leak. Keep your heels touching. Exhale and open your top knee like a clamshell. Crucially, do not let your pelvis roll backward. Keep your top hip stacked directly over the bottom hip. Imagine there's a wall behind you preventing you from rolling back. Hold the open position for 2 seconds. Inhale and slowly close the knee. You should feel a specific burn in the side of your buttock. That is the gluteus medius waking up. If you feel it in the front of your hip, you are likely rolling your hips. Adjust your position. Lean forward slightly if you need to. We will do 10 on the right side, then flip over and do 10 on the left. By strengthening the glutes, we take the load off the pelvic floor. We are giving the bladder a stronger hammock to rest in. You might notice that walking feels more stable after doing these for a week. That stability directly translates to better bladder control. Exercise number 4, functional sit to stand. We've done the floor work. Now, we must translate this to real life. Because you don't leak when you're lying on a yoga mat. You leak when you move. In physical therapy, we call this the knack. It is the art of pre-contracting your protection muscles before the pressure hits. Sit on the edge of a sturdy chair. Feet flat on the floor, hip width apart. When you stand up from a chair, you generate a massive amount of downward pressure on your bladder. If you just heave yourself up with a grunt, holding your breath, you're practically forcing urine out. We need to change how you stand. Scoot to the edge of the chair. Inhale and relax your belly. Before you move, start your exhale, and engage that zipper sensation, lifting the pelvic floor. While you're exhaling and lifting, lean forward and stand up. Keep exhaling until you're fully standing. You are creating a pressure sandwich. By engaging the pelvic floor before the movement, you are closing the bladder neck before the pressure wave hits it. You are staying one step ahead of the leak. Let's drill this. Sit back down. Relax fully. Now, engage, exhale, and stand. Sit back down, engage, exhale, and stand. We are reprogramming your brain. Eventually, you won't have to think about this. your body will learn, oh, we're standing up? I better lock the gate. This exercise is crucial for people who leak when getting out of cars or off soft sofas. Let's do 10 repetitions. Focus on the timing. Engagement comes first. Movement comes second. Exercise number 5, heel slides. Our final exercise targets the ability of the core to maintain pressure while your limbs are moving. This simulates walking or marching. Lie back down on your back, knees bent, feet flat. Find that neutral spine again. It's easy to hold a contraction when you are perfectly still. It's much harder to hold it when your legs are moving. But you need this control for walking, climbing stairs, or rushing to the bathroom without losing it on the way. Inhale to prepare, exhale, engage your zipper core. Keep that core engaged. Now, slowly slide your right heel along the floor until your leg is straight. Do not let your back arch. Do not let your belly pop up. Keep the jeans zipped. Inhale and drag the heel back to the starting position. The goal here is not to move the leg. The goal is to keep the pelvis absolutely still while the leg moves. Imagine you have a bowl of hot soup resting on your lower belly. As you slide your leg, don't spill the soup. This is called eccentric control. We're teaching your core to stabilize the bladder against the weight of your moving legs. This is directly applicable to the urgency you feel when you're walking home and suddenly need to go. Strong eccentric control calms the bladder signals. Do 10 slow slides on each leg. If this is too easy, you can try lifting the foot slightly off the floor, but only if your back stays flat. Quality over quantity. You have done the work. You have engaged the muscles. Now, as a bonus, I want to give you 3 lifestyle hacks that can reduce your symptoms by another 30% starting tomorrow. These are things your doctor might have forgotten to mention. Hack number 1 is the constipation connection. You cannot fix your bladder if you ignore your bowels. The rectum and the bladder are roommates. They live right next to each other. In fact, they share space. If you are chronically constipated, the full rectum pushes against the bladder, reducing its capacity and irritating the nerves. If you're straining to have a bowel movement, you are weakening your pelvic floor every single day. Increase your fiber, drink your water, and use a toilet stool to elevate your knees. Clearing the neighbor gives the bladder room to function properly. Hack number 2 is identify your personal kryptonite. Many people don't realize that their diet is chemically irritating their bladder lining. When the bladder lining gets irritated, it tries to expel the irritant. That means it contracts violently, causing leaks. For 1 week, try eliminating the big 3: caffeine, carbonation, and artificial sweeteners. I know, it's hard. But acidic urine is angry urine. Try switching to water or herbal tea for just 7 days. If your leaks decrease, you have your answer. You might not need surgery. You might just need to switch to decaf. Hack number 3 is stop just in case peeing. We are all guilty of this. You leave the house, so you go to the bathroom just in case, even if you don't need to, or you go every hour to avoid an accident. This habit actually shrinks your bladder capacity. You are training your bladder to signal full when it's only holding a tiny amount. You are sensitizing the organ. Instead, practice timed voiding. If you feel the urge after only 30 minutes, try to wait 10 more minutes. Distract yourself. Squeeze your pelvic floor using the exercises we just did to inhibit the urge. Sit down and breathe. Gradually, over weeks, stretch the time between visits. Retrain your bladder to hold a normal volume. You are the boss, not the bladder. Leaking urine is common, but it's not normal. It's a sign that the pressure system in your body is out of balance. Today, you took the first step toward fixing that balance. You learned to zip up the core, engage the adductors and glutes, and manage pressure when you stand. Healing these tissues takes time. Muscle growth takes about 6 to 8 weeks of consistent practice. Do not get discouraged if you don't are perfectly dry tomorrow. You are undoing years of patterns. Wear the pads if you need them for confidence, but think of them as a temporary cast. not a permanent wardrobe. Keep doing these exercises every single day. And now I want to hear from you. Which of these 5 movements did you feel the most? Was it the zipper breath, or maybe the clamshell? Or maybe you have a personal tip that has helped you manage this condition. Please don't be shy. Share your experience in the comments below. Your story might help someone else in our community feel less alone. Thank you for trusting me with your health today. Keep breathing, keep moving, and I will see you in the next video.